Dr. Edje. I will let her introduce herself, and then we will get started on combating COVID-19 vaccine hesitancy in Black and Latinx communities. Dr. Edje.
Thank you so much. I'm going to actually go ahead and share my screen. Are you able to see my screen? Are you able to see my screen?
Yes.
Yep.
You're good, Lou.
Okay, great. All right, so thank you so much for having me and for that excellent talk that we had just beforehand. It really level sets and sets some ground foundation for the talk I'm going to do in just a bit here. I'm going to focus a little bit more on the Black and Latinx communities and talk a little bit about some of the tools that I found useful as I have had a different perspective. I think I bring 3 different perspectives to this discussion. Number one, I am in the Moderna trial, and that started off because I had a death in the family, and subsequently before the EUA from Moderna came through, I had 3 additional deaths, and then we've had none since then in the family. But then also I'm a physician, and I wanted to make sure that as a Moderna trial participant that I could go ahead and speak to my patients and be able to have some credibility behind, what the process was and what was going on with the vaccines. So I have nothing to disclose. I am the Associate Dean of Graduate Medical Education at the University of Cincinnati. So essentially, residents and fellows are folks who are training in their specialty area. And my job really is to make sure that their education is up to par, that they're getting all the resources they need for that, and that they're able to launch from a really good, healthy educational base into their careers. I am a family physician, so I have a little bit of a different perspective, but take care of kids of all ages. My youngest is 17 months old. So the objectives really are threefold. Number one, to be able to say why vaccine hesitancy is important in our pursuit of health equity. Number two, to be familiar with some causes of vaccine hesitancy. There'll be a tiny bit of overlap, but not much with Dr. Karas's. And then also to speak about 4 analogies that I found really helpful as I went through and have really talked in multiple different forums about this. So number one, talking about equality versus equity. Equality really is everyone gets exactly the same thing. So you see these crates are exactly the same size, but not everyone can see the baseball game. Here, equity is different. You provide what you need. It's outcomes based, meaning that everyone really wants to see the baseball game. Let's get everyone to that point, regardless of what it takes underneath here. And then the last one here is inclusive design, which is really trying to make sure that we actually have a system that is set up to where everyone see the baseball game and not need any extra help. If you were to put that in the context of vaccines, first of all, equality would be same size crate. Everyone gets a vaccine and it's free for everybody. But the thing about it is equity is different. Everyone becomes vaccinated. It's outcomes oriented. And so to do that, you really have to acknowledge some uncomfortable truths that have littered the pathway to discussion about vaccines for a lot of people. We'll talk about one of those incidents. You also have to break down barriers, for example, to access. If we have vaccine drive-through clinics and somebody does not have a car, well, that free vaccine is not helpful without us addressing some of those barriers. And then everyone gets vaccinated. So again, equality would be free vaccine for all, but equity would mean let's make sure that everyone becomes vaccinated. What is health equity? It really is the assurance of the conditions for optimal health for all people. And it requires 3 major principles. First of all, that we have to value individuals and populations equally, that we have to recognize historic injustices, and then we have to provide resources according to the need. Again, number of crates that are needed to get the same outcome. And the whole purpose of having a focus on this is that health disparities will be eliminated when health equity is achieved. So we have to have them lockstep with each other to actually achieve equal health for everybody. So vaccine hesitancy, what we do know, and this is from the NAACP coronavirus hesitancy study, and it actually shows that Black Americans, 55% know somebody who has been diagnosed with COVID, 48% know somebody who's died or been hospitalized. among Latinx, that's a little bit higher with 73% who know somebody and 52 who have known somebody who's hospitalized or died. As far as that goes, we also know that as far as trust goes, and Dr. Karras touched on this a little bit, trust in vaccine safety, you see how low those numbers are for Black Americans. It's 14%, a little bit higher in Latinx. And then trust in the effectiveness, also really low at 18% for Blacks and 40% for Latinx. And then trust in culturally specific testing. This was really important. Moderna actually halted their trial nationwide. They had 90 sites, of which UC Health is one of them, but they halted their trial to make sure that the percentage of folks who were in the trial were actually reflective of the percentage of Black and Latinx individuals in the community, so that we could go to those communities and say, yes, this was tested in us, and to help to eliminate one of the hesitancy concerns. Additionally, if you look at trust as far as leaders, trust in Black versus white community leaders, a Black patient is twice as likely to trust somebody who looks like them when they're relaying information. I take care of many Black patients in my community, and I get that all the time. I've had a patient who I walked into the room, and within a minute we had hugged because she was crying when I walked in. She said, I've never had a Black doctor before. This helps me not to have to explain some shared experiences that we've had. Also, trust in healthcare providers is very high. So that's something that's an important avenue to use in discussions. Also, believe it or not, Dr. Fauci has very high ratings in the Black and Latinx community, and so does the FDA. Less so the drug companies, as you see down there at 19%. One of the things that was a big concern, this is back the Tuskegee Institute trial. Basically, this was back in 1932, we had 623 Black men who were approached on behalf of the US Public Health Service, faith leaders, community servants, and also the medical profession. So trusted people, and we're told that they were gonna get free healthcare and free meals, and they were gonna be treated for syphilis. It was a study on syphilis. At that time, penicillin had not been discovered, but over the course of the 40 years of the trial, that was actually discovered, and it was withheld from them. Additionally, and this is one piece that was very compelling to me as a physician, a letter was sent to all the physicians in the area to not treat these individuals if they came for healthcare at their offices. But again, it wasn't until 40 years later that the Washington Star News published an article exposing the fact that these gentlemen were essentially left to fend for themselves within the trial without getting treatment. Lots of things have happened actually since then. So for example, institutional review boards are out there right now. So an IRB is something that has been put into place to make sure that there are ethical standards that are met as individuals are in trials, and there has to be training for everyone who's going to have a trial that involves humans. And we'll talk a little bit more about that, but just mentioning things like that is very helpful. The other thing is, this here is Kizzmekia Corbett. She is actually a scientist. She's one of the 2 lead scientists that discovered the Moderna vaccine. And the importance here is, as we mentioned before, there's a high trust with Dr. Fauci. Mentioning when I speak to patients that she works in Dr. Fauci's lab and works with him, it actually does help to increase the confidence in that space, as well as the fact that she looks like some of the patients that I speak to. As we move from vaccine hesitant to vaccine hopeful, we look at some of the data that is coming out right now out of the Kaiser Family Foundation. And this is it's an interactive thing. You can actually just Google it, and it will give you up-to-date information. It updates about every week or so. But basically, you can actually go ahead and click on certain buttons for different races that you want to check to see what their attitudes and responses are. So right here, this slide is on vaccine enthusiasm. And the navy line, the very dark one that's going up, that's got 70% there at the right side of it, just shows that those are individuals who have already gotten the vaccine or will get it as soon as possible. So for Black adults, it's high. But if you go to the dark green line, that starts to uptick at 16% at the right side of the screen there, it just goes to show that we're actually getting a slowdown in the enthusiasm. And part of that, between December 2020 to now has been with the boosters. And I think some sentiment that having a booster proves that the original didn't work, which is a fallacy. That is incorrect. If you go then and look at Hispanic adults with the same information, you have 66% that say, absolutely, I've already gotten it, I'll get it as soon as possible. You've got more of a straight line on those who say, definitely won't get it. And then for our Caucasian patients, we see that there's a fairly straight line there for the dark green at 15%, pretty much stayed that way, of folks who say they won't get it. This next, and so summary then for that one is that an increase in vaccine enthusiasm has slowed toward, across all racial and ethnic groups except for Caucasian patients. Right here, again, this is also Kaiser Family Foundation data, and it keeps track. And we found that there is a bit of a political divide. The lower percentages for patients who've said they already have been vaccinated, we see that the lowest numbers here are in the Republicans at 54%, and then also in patients between age 18 and 49. So the two groups between being about 57 and 58%. If you look at folks who are going to be in the definitely not category, based on what we just said, you'd also expect that in the Republican category there, 20% is pretty high, saying I will definitely not get it, and also our younger patients. So when we talk about hesitancy, we need to keep this information in mind so that we're actually meeting people where they are when they start this conversation. So this slide looks at the income of parents as it relates to their children between age 12 and 17 and the schools. So we find that the parents who actually have a higher income are more likely to be have their kids in schools where the school has given them information about COVID-19, that the schools have also encouraged them to get vaccinated, have mandated that they get vaccinated, and have asked about the kids' immune status. So higher income parents are more likely to say their child's school has provided COVID-19 information or encouraged it. Here we see that when schools encourage vaccination, the children are more likely to get vaccinated. And you see at the very top blue bar, if the school encouraged vaccination, 62% of those kids got their vaccine. If the school did not, it was down at 30%. Also, if the school provided information about COVID vaccine, 58% went ahead and got vaccinated. And if the school did not provide information, then it was down at 32%. And so again, parents whose children's school encouraged vaccination were much more likely to have their kids vaccinated. This one right here actually shows concerns of patients, of parents who have not gotten their kids vaccinated. And the concern here is basically for your Black patients and Latinx patients, they were more concerned about side effects than were Caucasian patients. They were also more likely to be concerned about fertility, and that they would be required to have the vaccine when they really didn't want it. Also, you see at the very bottom here, access was a big issue. And not so much that there weren't tons of vaccines around, but am I going to be able to be paid for time off work to go ahead and get vaccinated? Is somebody going to be able to cover my shift while I'm out to get vaccinated or get my child vaccinated? So again, Hispanic and Black patients are more likely than white parents to be concerned about access-related barriers. And then this last one from Kaiser Family Foundation is about shots and the booster. Has that caused you to be more concerned about the effectiveness of COVID-19? And Black and Hispanic adults were more concerned than white adults about the efficacy and the effectiveness of vaccines since a booster came out. I will also speak personally about access. My grandmother, who's in the middle there, is 97 years old. And so when the vaccine was approved back in December, the mRNA vaccine was approved back in December, she would have been at the top of the age group as a 97-year-old woman. But it took her till February, even though my mother, who has a doctorate, was calling every day to try and get in. Folks were taking the places within our community, driving up from Florida, driving from other places, and she did not have access. So it's very real, even though we had plenty of vaccines as well. Barriers, definitely, if you don't have a physician, you're definitely going to fall through the crack if somebody's not going to be able to order. Luckily, that sort of helped out to have free vaccines at pharmacies, and that changed over time. No phone, no internet, no car, no time to get off in the workday. Innate skills for physicians, definitely, as Dr. Karras mentioned, patient stories are very compelling. There's credibility, and we'll look at that in just a second. Technical and scientific knowledge, access to understanding of research and being able to translate those in the information and research into bite-sized nuggets that patients can understand, and then experiencing advocating for individuals, which we really do every day. This slide looks at public trust, and physicians really are number 3 in the list of different folks as far as trust. So, if you're not able to get the message across to a patient, definitely referring them to their physician is an important thing to consider as well. As far as the public trust, since the pandemic, we really have seen a change for the better, and confidence that medical scientists will act in the best interest of the public has gone up between 2019 and 2020. Overall, the view of medical doctors is mostly positive and increasing. And Dr. Fauci, as I show here, he's been instrumental in also maintaining his political cool all the way through multiple different regimens of folks. So whether Democrat or Republican presidents, he's been able to be a really useful tool because he's stuck to the science, and that's always a good bet for all of us as well. This slide actually shows that there has been a partisan divide in the confidence in medical scientists and scientists in general, and that Democrats have a more trusting basis in science than, and that has grown over time. As you can see here in 2019, went up from 37 to 53 in 2020. So again, knowing this information is useful, not to be antagonistic, but to go ahead and actually understand things that may need to come up in the discussion if we're really genuinely trying to get people vaccinated. Skills that we can develop as providers and healthcare workers is to go ahead and define our goals and audience and be specific. We'll talk about that in a second. Crafting our personal stories to frame the issue, developing and sticking to your message. And again, the basis should always be science. Recognizing opportunities for advocacy, they're all over the place. And then developing relationships with partners who can be vessels to get that information across. So one thing, I love this slide, women, this is information from the CDC, women really are often the chief medical officers of our family. And according to CDC data, 79% of women pick the family's physician, a pediatrician or family physician, 77% make the medical visit appointments, and then 59% actually make the major health decisions in the family. So very important to make sure you're involving your mothers, as you know. I will go over 4 different analogies that I found helpful. I was counting up how many things I've done since the pandemic between podcasts and media events and things like that. I've done 97, this will be 98. And these analogies have been very helpful for me in the course of talking to patients. So changing the key in a changing lock, icing on the cake, safety deposit box, and Snapchat message. And I'll do a slide for each one of these. So for the patients who are like, yeah, no, doc, I'm good. I'm gonna just wait and see. I want it to, percolate a little bit more and see how it works with everybody else. I think of this. Number one, if you think about the virus being a lock and the vaccine being a key, what you do not want to do is get concerned that your key is not going to fit in your lock anymore. So when you have a virus, like I said, being the lock, when you have a variant, that lock is starting to change shape. It's starting to change its functions, starting to change. And you want to make sure your vaccine still works against your variant. And so this is why it's really important. So far, we have been fortunate in that, yes, our Moderna vaccines and our Pfizer and so forth work very well still against, against the Delta variant. But the concern is if we keep on going into Lambda and a couple of others, that could be a problem. And you don't want to have to make brand spanking new vaccines to deal with these changing viruses. So it's a race against time. People have to get vaccinated. There's no time to sit on the fence while the variants continue to change. The next one, icing on the cake. This one is for the vaccine was developed way too fast, Dr. Edje. I don't trust it. It's only been around. I want some more time. For this one, I think about the icing on the cake. And We have the SARS-CoV-2 virus, which is the COVID-19 virus, has actually been, it's a part of the family of coronaviruses. We have been studying coronaviruses for 20 years. So each one of those cases is 10 years. So 20 years worth of study. And then when the pandemic hit, all we had to do was determine the genome of the spike protein that Dr. Karras had mentioned before so that we can make the vaccine. That took 66 days. So that was like discovering the flavor of the icing and then icing the cake. So this was not a vaccine that took just 11 months to develop. This was 20 years in the making, and we just had to find the last little piece to get the information across. This third analogy of 4 is the safety deposit box. And this is for the women in particular who are concerned about vaccine effects on fertility. And I like to think of a vault. And if you think about your cell containing DNA, DNA would be a blueprint to make another Edje. And that is locked in the nucleus in the cell like a safety deposit box in that vault. When you inject mRNA, it has absolutely zero access to the safety deposit box. It will not change your DNA. It will not change the fetus's DNA. It will not affect fertility of the man or anything like that. And so that is something that has been useful as well. It really does, you're locked down. It's way too important for your DNA to be free and easy in the rest of the cell. The other thing is a Snapchat message. This one is for the vaccine may have harmful side effects on my body. And so a Snapchat message, I don't use Snapchat, but my 23-year-old daughter does. It's a message on social media that has just a really short time that it's there and then it disappears. It's not a permanent message. And so I think about the fact that mRNA lasts in the system for about 48 hours. It is very unstable. And so that's why that little lipid droplet called nanoparticle is around it to help inject it into the body and keep it stable for that. But then your side effects only should last about 48 hours if you're going to have them. So fatigue, fever, mild headache, body aches, and muscle aches, those are, and joint pain, those are really going to only last from the shot about 48 hours at the most, and then it's outside your body. Just briefly on catalytic partnerships, I'm going ahead and trying to get the message out and multiplying the effectiveness of what you're saying, speaking to community leaders, being familiar with Black and Latinx physicians in town, faith leaders, local businesses, schools, and primary care are definitely important. So again, last week, it was trial day 382. I got my booster shot. Again, I got into the Moderna trial because I wanted to have the credibility of being able to say, yes, I got my shot too. I did not hesitate. I got my shot, the very first one, September 12th. We had no idea whether mRNA technology was going to work at all at that point. And we all celebrated, all 30,000 of us in the Moderna trial, when we found out that it was effective. University of Cincinnati is one of the 90 trial sites in the country. The interesting thing and the important thing is that internally, the trial team was made of Black and Latinx clinical researchers as well. There was a base structure of a network within the Black and Latinx community. Shana, who's on the left here, she speaks fluent Spanish, and she is the person who's my direct connect. She's the one who consented and did all that good stuff with me. And then this gentleman who was on the right, unfortunately passed on several weeks ago. He was Gary. He would take blood, and I'm still in the trial for a full 25 months to make sure my immunity stays good. And so we have a lot of boots on the ground. Then externally, what we did is we went ahead and partnered with key organizations. So the Cincinnati Medical Association is a group of Black physicians here in town, equipped them with knowledge. Dr. Fichtenbaum, who is the primary lead for the trial, came and spoke at one of our meetings, told us everything about the trial so that we were equipped with tools to talk to our patients. And for that reason, we've also been partnering with the Closing the Health Gap so we can meet patients where they are. So every couple of weeks, we have on a weekend just 1 hour where people can come back and dip back into the well of knowledge and feel more comfortable with going ahead and getting vaccinated. But we said between 18 and 49 is the age group where folks are most hesitant. We've gone ahead and tried to make sure that we're meeting people with DJs and things like that where they are, where they live. Also, just recently did something else with the school board just to make sure we're getting into the schools and speaking specifically to some of the Black and Latinx parents and kids. And then my story was picked up way back when I joined the trial, and I've sort of just had the fortune of being able to be involved with all of these different entities in some arena. This right here is also leveraging, I'll just go back one, leveraging the fact that we're physicians to go ahead and advocate for patients. So this was a letter that was written by 450 physicians here in town to try and have the school board do mandatory vaccinations for patients. We've also had Cincinnati Black Medical Association go ahead and actually write a letter to all the Black and Latinx folks in town, patients, to say we really do advocate for you getting this. And then talking about Ohio AAP resources, we have a podcast library that is there. And one of these we recorded earlier in this year with our president there. And then also there are vaccine hesitancy, other resources that are available. Dr. Karras mentioned some of them. But just some where you have a QR code, you can go ahead and get some information on your phone that you can utilize and carry around with you. So as far as objectives, one was to be able to articulate why addressing vaccine hesitancy is important, which we did. To be familiar with some causes of vaccine hesitancy, which we reviewed the Tuskegee trial and some others, and then be familiar with the 4 different analogies that I found helpful over the course of this 18 months. Key in a changing log, icing on the cake, safety deposit block, and Snapchat message. And so one thing quote-wise that I think is really important, life's most persistent and urgent question is, what are you doing for others? And this was from Martin Luther King before our pandemic. And so what more, this is true during a pandemic. And that is all I had. I wanted to say thank you.